Hello, I'm Stan Goff. I'm the managing editor of Dental Products Report, and today I have the pleasure of speaking with Dr. Jason Goodchild. And he is not only a practicing dentist in Havertown, Pennsylvania, and he's also the vice president of clinical affairs for Premier Dental Products Co. So real good perspective on practicing dentists as well as the industry. And so I was hoping you could share some wonderful thoughts on how it's been kind of a crazy 2020, but I think there's been some good signs for the dental industry.
Yeah, thanks, Stan. Happy to be here and answer some questions.
Well, first off, the country as a whole has had ups and downs with the spikes and positive tests. Correct me if I'm wrong, but it does seem as if there has not been a lot of negative news around the dental industry and in terms of patients and staff. Does that have something to do with the fact that there's so many precautions taken and new protocols?
Yeah, I've kind of heard the same thing or lack of the same thing, which is, I think when we were trying to get back to work, everybody was concerned, dentistry being named as one of the more dangerous places to be during the COVID outbreak. But, I'm just not hearing, with dentists, outbreaks in dental offices or dental team members. It doesn't mean it isn't happening. I just haven't been seeing it. I know that was foremost in the minds of many practitioners, and I really believe that dentistry as a whole has been pretty good and over the years, and probably more prepared than we were given credit for in regards to infection control and being able to handle some of this stuff. But then I think dental teams took it to another level. We were wearing level 1 masks, or maybe even not even level 1 masks. Now we're wearing, N95s, level 3s, maybe multiple masks, air filtration, a better emphasis on high vac suction and pre-procedural rinses and interviews and temp checks. I mean, I really believe dentistry, took it to an endpoint that it needed to be. We followed the guidelines, and because of all the the thinking that, dentistry was was a high risk environment, that, we really did, do our best to protect ourselves, our team members, and our patients.
Yeah, I mean, the dental offices have been known for great infection control, but I think this whole COVID-19 required a little bit extra. And what you're saying is the dental industry has stepped up to the plate.
I believe so, yes. I think that when you look at some of the industries that have been hardest hit during this time, I think dentistry is right at the top of the list. And so in order to get back into the office and provide dental care, for the people who obviously really needed it, I mean, we were handling emergencies, but we had treatment plan procedures and things that needed to get taken care of. And then, of course, dental offices, from an economic standpoint, we needed to get back to work. And to do that, I really felt like the dental offices, the dental teams have stepped up and to provide the needed dental care in a safe manner and to protect teams. I just don't think, there's any way we could have done. I mean, we had to do it, to give ourselves the safety when we were being in the office over those, hours of the day, but also to give patients the confidence that it was going to be safe for them to be back in the office. And so all of those things put together means that, the dentistry and the dental office is a tightly controlled environment right now. I believe, at least in the practices that I've seen and talked to, we're trying to do everything we possibly can. Because, if you've been around dentists and dental teams, we spend so many hours in the dental office over a work week. It's a second home, and we have to make that second home safe. Is equally important, the patients who come in have to feel like we're doing everything we can to keep them safe. Before, in my office, I used to ask my dental team members to sit where patients sit, look around to make sure that our office looks clean, looks well put together, looks organized. Now we're doing even more of that. I mean, with the idea that not only is it going to be clean and organized, but it has to be, has to just appear, and not only appear, but be just spick and span. I mean, it just has to be, for everybody involved.
And in your experience, in your own practicing, as well as what you've heard from other dentists, the concern for patients to return, is that kind of not been as bad as we had thought, or is it kind of at least gotten better now, where it seems as if patients that need their care are coming to the dentist?
Well, I could speak from my own experience and some of the other dentists I've spoken to, and the feedback from them has been the same as what I'm seeing, which is patients have been coming back, have been feeling safe. I think one of the things that we have done, and I know some of my other friends and colleagues have tried to do, was over communicate via whatever channels they had, which was social media, email, direct mail, whatever, to be able to communicate with patients to say, hey, these are the things that we're going to be doing to keep you safe. The office experience is going to be different when we return. There's going to be interviews, waiting in your car, temp checks. We're going to be wearing masks and shields at all times. All the things that we were going to be doing to keep them safe, so that when it did come time for them to be back in the office, they felt great. I mean, we've had a great response from patients wanting to get back in. People who are on a tight recall schedule, they're really wanting to come back in to make sure they're staying healthy, and things that they had treatment planned or emergencies they needed to get done. Patients are, they're coming back, and that's great to see.
I imagine the communication with patients, even with the team to communicate with the patients during the shutdowns was absolutely critical. But I imagine now it's rather key now to make sure that when they are coming back and you are open, that they know what you've done and what you're doing.
Yeah, I mean, I think that one of the things that we have done is we have a dedicated team member that's doing nothing else during the day. I mean, we rotate them. But one team member at all times is just cleaning the office. Whereas before, that person may have been helping with other procedures or filling in on the phone. We don't do any of that now. That dedicated team member is just going around and cleaning the office at all times. And one of the things I like to tell patients is that the things that we have done or added to the office during this time to increase levels of safety and mitigate any risks that occur in the dental office. We're doing iodine rinsing, we're doing temperature checks, we're doing that dedicated team member for cleaning. We're wearing high-level masks at all times. I mean, one of the interesting things is, I don't know the last time we spoke, Stan, but I've added this disgusting beard on my face. It's the very first, first time in my entire life that I've been able to realize the epic awfulness of this beard. And, wearing a mask from the moment you walk in to the moment you leave is quite a task. But wearing it with this facial hair, I really thought that I would just leave it for a while. But I'm really considering shaving it because it's just so disgusting and uncomfortable with a mask that you wear from the moment you walk in to the moment you leave the office. So for me, that's, my struggle right now, unfortunately.
Now, along those lines, have you had hygienists or staff members, assistants talk about just maybe being exhausted from wearing the mask all the time, or just different feelings while they're doing this new donning of the PPE?
Yeah, I think when we started, I think there was a level of mental fatigue that went along with the additional PPE, wearing gowns and shields and masks and, changing them and doing it the right way, and, trying to maintain PPE rather than dispose of it, and trying to preserve it because we were having trouble getting it. Now, some of that has eased a little bit, and some of the mental fatigue I don't think is quite as bad because we're used to it. But yes, I do believe that we went through a period where we're trying to relearn how to properly put on and take off, preserve it, and even wear it the right way. And also the idea of wearing shields where we weren't wearing shields before, or how do we illuminate where we're using our headlamps, or we're using overhead lamps. I mean, it was a relearning process, but I think we've settled in pretty good right now. And when I was in the office yesterday, I couldn't help feeling that, dentistry is dentistry. It almost felt that we were the term is way overused now, but the new normal had sort of set in, and the idea that it was just kind of back to doing what we do because everybody had learned their little dance steps in the office, and we knew how to make it work.
And I think not only just getting more comfortable and used to that, but I think also when you see the good results with it, when you're taking these steps and then you are not getting patients and staff sick. I mean, I think that just kind of helps hammer home the idea that, hey, this is important, this is needed, and it's working. Yeah,
I mean, I guess, I don't have any, it's working in my eyes because we've all maintained, we're healthy, we're safe, and we're feeling safe, and the patients are feeling good, and they're coming to the office, and we're able to provide great patient care. So yes, I think we are being successful there.
Now, and shifting you a little bit to your role with the Premier Dental Products as a clinical affairs guy, are there I don't know, newer techniques, products, procedures that dentists might be taking up now post COVID-19, or at least things that they're thinking about doing to try to maybe be more efficient, try to I don't know, win back some of those lost times these last few months?
Yeah, it's, I think the word that it really sticks in my mind from what you just said, Stan, was the idea of efficiency, is that efficiency in dentistry was always a big thing. I mean, we understand, at least in the general office, that, margins are small and overhead is high. And we're always seeking ways to be more efficient in the dental office, the way we bring patients through the office. Now, that's taken a big step backwards because we can't be as efficient as we were with, we're having reduced patient flow. We're doing additional PPE, additional procedures to see them in the office. So, I mean, there's efficiency has taken a step backwards. But as we learn how to do this and we're getting better at seeing patients, I think a return to efficiency is going to be even more important. When you asked about Premier, every dental manufacturer, I'm sure, is thinking about ways that their products can fit into that new efficiency model. And particularly aerosols has been, a buzzword. What procedures, what equipment, what techniques can we do to help provide excellent patient care, but also minimize aerosols? And so one of the things that, if I speak about Premier for just a second, it's the idea that we have a cordless Prophy handpiece, and we're very pleased with it. It's called the AeroPro. What makes it different than other cordless Prophy handpieces is that it's one button on off, no rheostat. But the interesting thing, and the reason I bring it up now, is because when you push the button on to use the polisher, it creates a constant speed. And we can adjust speeds to, a little higher or even lower speeds. What we believe, and that's kind of the thing we've been talking about, is when people step on rheostats, sometimes it overspins. It'll go too fast, then you'll lower it down to where you want it to go. And I call that overspinning. And, if you're able to provide a constant speed for polishing and prevent overspinning, maybe that prevents a splatter and can help reduce aerosols. So we're thinking that way now. We're trying to figure out how materials, techniques, equipment can help mitigate that stuff. I mean, I don't think we can reduce aerosols in the dental office. It's just the nature of the beast, unfortunately. But how can we reduce them? Because we're mindful about it right now. One of the things that's, in the back of my mind always is, how can I provide the same level of care as before, the highest possible quality, while also keeping those kinds of things in the back of my mind. You know what I mean? We're balancing it now, and we're looking for those solutions, and we're thinking about our current procedures and the way we do things, and how do we make them even safer.
Gotcha. And along the lines with Premier, I mean, I just when there were a couple of months with everything shut down, obviously dentists weren't buying as many consumables and products. I imagine, I'm hopeful that now that everything is closer back to normal, that things are picking up and you're seeing more patients are getting treated, more products are being purchased, and more positive feedback, I'd assume.
Yeah, I know if you've talked to anybody in industry, I think that they would probably resoundingly tell you that it was an awful time for everybody. Not to make light of it in any way, it's, it was bad for the country, bad for everybody involved, and certainly the manufacturers took a hit there because nobody was doing dentistry. I mean, we were doing emergencies, but we weren't sure, and we were, frankly, probably a bit scared. How to do this, how to do dentistry, and so very little dentistry was being done, and very little numbers of products were being purchased, and now, thankfully, some of that is coming back from a business perspective. But at the forefront, I think until we had a way to, or had some ideas about providing safe care for our patients and for the environment, for the team, that shutdown was kind of, in my mind, the right thing. It was painful. Again, it was bad for business, but it was needed for safety. So we had to do it.
Along those lines, and just to be backtracking a little bit, we've talked in the past about the CDC and the ADA. There were some good guidelines. There were some good recommendations. Do you feel the industry as a whole did a pretty good job of communicating on the fly as they learn more about this wonderful pandemic and how to take steps to stay safe going forward?
Yeah, just like what I said earlier about over communicating, I feel like there was a lot of over communication, and not in a bad way, but in a good way, because we were figuring, just like you said, we were figuring it out on the fly. I think when you and I spoke previously, the analogy that I heard from a good friend of mine, Dr. Michael Glick, was that, he said, we're building the airplane as we fly it, and that's exactly true. We were trying to figure it out on the fly. A lot of stuff being thrown at the dental professionals. And one of the dangers, I thought, is that there was so much information coming at you, and to be able to synthesize it into what is actually true, what can we put in place in our offices, what's really going to work for us. It required constant reading and trying to digest it all. And I still think we're in that area where we're trying to still continue to try and figure it out, but most dental offices have kind of, I think most of them have gotten back to some level of normal.
Yeah, I think there still are some suggestions out there or potential solutions that haven't been proven. So there's just still, people need a little bit more science, a little bit more history behind some of these things. But like you said, it's good to have a lot of good information, even if not every bit of it's great.
Yeah, I think dentists, I think, in many ways subscribe to a belt and suspenders approach. And when you think about like even restorative dentistry, when we used to do amalgam, right? We would prep little keyholes and little retentive grooves in the teeth to hold amalgam in. But when we moved to composite and we really didn't need that stuff anymore, we still did it. Meaning we still put the retentive grooves in even though we were bonding it in. So, it's like the belt and suspenders approach. Dentists will do whatever they can and then to make sure that the procedure will be successful. And in this time, I think we're seeing that too. We're maybe going above and beyond. We're doing additional air filtration, additional extra oral suction units. We're doing additional PPE. I mean, we're doing everything we possibly can. And I think that's a good message for not only providers, but patients, is that, I think dentistry, we're trying to do, without the science to back it up, we're trying to do everything we can to try and be as safe as possible and provide the kind of quality care that we were before.
And I believe patients would have to appreciate that. I mean, if they feel confident that their dentist doing everything they can.
I hope so. One of the things that, I look at it, I was standing outside in the hall by myself. No one was around me, social distancing. I stay in the office. And I was just sort of watching the two hygienists work. And, it just seemed like patients had adjusted to what we were doing. And this was just their normal recall hygiene appointment. For that moment, it felt pretty normal. And that was nice.
Which is a good thing. Which is a good thing going forward.
Yeah.
And speaking of education, the pandemic has canceled trade shows, a lot, pretty much all hands-on or big live courses. How do you think going forward and/or currently staff and even companies like Premier can get that education out for the people who need it?
Yeah, that's a great question, Stan. Everything has been canceled this year, and besides what I do for Premier and the educational stuff I do for them, I do stuff privately. I have some courses at dental schools around the country and with some private organizations, and all of that has been canceled. And the majority of it has been actually transferred online and made virtual very quickly. I mean, everybody's pivoted very quickly to an online model. I'm not sure. I think it's improving, but in-person education is I think still the best. But we can't do that, so we're going to do the best we can virtually. And actually, that was the start of the genesis of this bad beard, was the idea that, well, the next time I travel for a show or education, then I'll shave it. And my wife said to me, she said, that could be next year, and that's really not going to work for me. So it may be coming off soon. But when it comes to these kinds of things like trade shows, larger shows, the impact of the cancellation of one of those large shows is huge, from the people attending for education to the vendors to the food service to everybody that will be providing it. I mean, it's just a big loss for the profession and certainly the economy. I don't know. I'm hoping that in 21 that you'll see some of that stuff come back. I'm just not sure yet. When it comes to bringing people, like, for example, Chicago, where you're from, Stan, such a big conference, Chicago Midwinter, and international, bringing in so many people internationally. How will that change? I think a lot remains to be seen, but it's unfortunate, but virtual education, online education, I think is kind of filled in some of those gaps, and I think it will continue to get better. Whereas, you used to see sort of pre-recorded education. Now you're seeing, some live stuff virtually, which is really great. I miss the travel. I miss the in-person education, but, hopefully we'll be back soon.
Yeah, we're hoping for a much better 2021, and the industry as a whole, provided things keep going in the right direction. Like you said, patients are coming back. Practices are having full schedules, even if they're taking a little longer. It does seem as if we're going in the right direction, and the hope is that things can be much better in 2021.
Yeah, I think if everybody continues to do the things that we've all been hearing about, being smart, wearing masks, that kind of stuff, I think we can continue to go in the right direction. I know that my family, I know that my dental team and the people I'm working with, we're trying everything we can to do the right thing. And because we want to get, I can't even imagine getting on a plane right now, or, sitting in a restaurant, but hopefully all that stuff comes back, and, we can have back to some level of where we were before. But to answer one of your other questions, Stan, the things I'm hearing, not only from within Premier, but from with other manufacturing colleagues, is that, things are coming back, and June was pretty good for most dental offices. I was hearing. So, hopefully that trend continues. Some of the data from the ADA, I'm sure you're aware of that stuff, is, hey, we've seen a bit of a bounce back, but maybe a bit of a leveling off. And that may have something to do with just all the extra stuff we have to do in the office to keep people safe. We can't see the volume we were seeing before. But, a lot of good information is coming out and continues to come out. And I'm just hopeful that we continue going in the right direction.
And just finally, and we'll just touch on this briefly because we've covered it a little bit, the PPE, obviously there were lots of shortages early on, and there were some, not such a bad situation. Is doing okay for your practice? And as far as other dentists you've talked to, they've been able to get what they need to do their jobs? Yeah,
great question. For our office, we haven't had too much trouble, but I think it's very dealer dependent. Now, do you order from some of the big ones or little ones? How far do you want to go into the rabbit hole to find the PPE? I know even some state dental organizations have been helping with that as well. For us, we haven't had too much trouble, but one of the interesting things about PPE was that we had a bit of we were hearing about counterfeit PPE and low quality, and so that was pretty scary.
It's discouraging when you have
Yeah. For me, I haven't had too much trouble, but I talk to my friends all the time, and some people will say, well, hey, we're not having problems with masks now, we're having problems with gowns. And then somebody else will say, well, we're not having problems with gowns or masks, but now we're having problems with disinfectants. And so the term that a few of my colleagues have used is rationing, whereas that dealers can sometimes be rationing out supplies, and it makes perfect sense. You want to make sure that we can get a little bit to everybody, but you can't stock up like you might want to, or you have in the past. And so you need to sort of take what you can get, maybe even continue to look around for other sources. But it adds, whether it's the dentist or a team member or a combination that is going to be doing the ordering, it may add extra time, maybe even some extra stress, but with the right kind of patience, I think you can find what you need right now.
Gotcha. Well, I think we've addressed a lot of good stuff, and I appreciate your time. It's always fun talking to you. And we'll have to do this again sometime soon, but you stay safe and stay well. Thanks.
Yeah, thanks, Dan. You too.
Okay. Bye-bye.
Bye-bye.